Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. Welcome back to another episode of Dental Fuel. Dental Fuel is brought to you by 90-Day Jumpstart, a program to help you increase production and break free from financial stress. Welcome back to Dental Fuel. We are back with another guest, Dr. Dar Radfar. Dr. Radfar is a seasoned dentist with over 22 years of experience in the field. He is an advocate for integrating sleep apnea and snoring treatment within dental practices. In our first episode, Dr. Radfar dives into his personal journey of discovering his sleep apnea condition after a severe car accident. He shares his experience and insights gained over 22 years in practice, and he shares some clinical mistakes that he's made along the way. Let's listen in. Dr. Dar Radfar. Dr. Rad, welcome to Dental Fuel. How are you doing today?
Good. Thanks for having me on. I'm excited.
I'm so excited to have you here with us and to learn about you here at Dental Fuel. I would love if you tell me and our listeners a little bit about yourself.
So I'm a dentist that's been practicing for about 22 years now. I do about 25% of my practice is sleep apnea and snoring treatment. And the other 75% is like most of us here that do cut a bunch of crowns a month, just some Invisalign, traditional braces. I place implants. I try to do it all, but a lot of my practice is now doing a lot of sleep. I got into sleep in 2009. I fell asleep at the wheel myself. I crashed my car into a tree going about 40 miles an hour, having no idea that I had sleep apnea at the tender age of 32. I'm not the typical poster child, if there is one. I'm not overweight or anything like that, but I've learned a lot about sleep since I became patient zero at my office. They gave me a CPAP machine, a good old oxygen mask, and I told them no thank you. And in 2010, I made myself a mouthpiece. And since then, I've made over 1,600 mouthpieces in my office. Patients come from all over the country. And I also teach this stuff through my radseminar.com to other dentists so I can pay it forward. The more we teach each other how to do things, the more we can help our patients and hopefully save lives and prevent people from getting into car accidents like I did.
Wow, what a huge wake-up call. Could you tell me a little bit about what happened the days after that accident?
Yeah, it's a great question. It was most of an embarrassing moment because it's like, wow, how did I fall asleep a block away from my home? Was that really the problem? Like, what was going on in my life? You start guessing yourself on how hard you're working. Are you putting enough time for yourself? Giving yourself enough sleep time in general, let alone quality sleep? And so at the time, I was told I was snoring a little bit, especially if I had a couple drinks. And the snoring was kind of a red flag for me, but also just feeling a little bit more tired throughout the day. And I was noticing that now. Obviously, I was more aware of it just because I got into that accident. I walked away, by the way, without a scratch, which was very surprising. And so I ended up looking up how to get a home sleep test. I asked one of my medical doctor friends, and I was able to get a home sleep test because who wants to go to a lab? And so a home sleep test was given, and we discovered a few weeks later that I have mild sleep apnea.
Wow. I'm sure that was so life-changing for you. How did you start to implement some of that sleep workflow into your practice?
Well, when they gave me the CPAP and I said, can't tolerate it, I realized that the studies out there show that the toleration of CPAP is around 30 to 35% for most studies, meaning out of 100 people, 30 to 35 people keep it and use it toleration, whether it's 5 nights a week for about 5 hours a night. It's not even a full 7 nights a week, 6 to 7 hours of sleep. So I couldn't tolerate it. And when I found out that there's a mouthpiece, and it changed my life, I wasn't as, let's call it, grumpy or kind of in the mood when I go to the dental office, in a bad mood in the mornings. I was definitely not snoring anymore. That just propelled me to like, wow, like who else could make this? No one but us dentists. You have to be a dental licensed professional in this country to make this. A medical doctor can't make it. Of course, we can't diagnose sleep apnea. We have to refer them for diagnosis by referring the patient for a home sleep study, which we can do in most states, and in almost 48 states in this country, a dentist can refer a patient to a sleep study. So I started talking to my patients about it. When they asked me, so how are you doing, doc? I'm like, well, I got into a car accident, fell asleep at the wheel. Now I wear this mouthpiece, and I had my mouthpiece in the office. I made 2 of them as a kind of like a sample. And like, oh yeah, my wife tells me, or my husband tells me I snore. Can you help me with that? And all of a sudden, it just became, I was one of I think the first ones in my community in California to be able to really talk about this and do it. And then I learned a lot of the things about the mouthpiece that it can't help everyone, but majority of patients that are mild to moderate sleep apnea patients, it can help them breathe better, so we can prevent a slew of medical conditions that we can get into. But the newest one is 5 times higher risk of cancer of any kind if you're not treated for it. So it's a lot, there's a lot of medical issues. It's not just an embarrassing thing or a dangerous thing about falling asleep at the wheel or a mood thing. One of the biggest topics right now is mental health, your emotional maturity or emotional replenishment of your serotonin and whatnot. You have to get good quality sleep to feel happy. I mean, how many times do we get poor sleep because we have kids that we're waking up in the middle of the night for, or we pulled all-nighters to be able to study for a final back in the day, or just in general, something keeps us up. And the next day, you're not your happy-go-lucky cheerleader type dentist or hygienist or staff member that comes in and doesn't allow 20 to 30 patients to get to them. You got to have good quality air, breathing, well sleep to be able to have a good mental well-being as well.
Thank you so much for sharing your story with us. And, I love the fact that, sleep is being incorporated more in the dental world, and that we can play such a huge part in really helping our patients transform their lives, starting with, something so big and yet so, looked at as so small as, starting with our sleep. But Dr. Rad, I'd like to get into the nitty gritty here. And here at Dental Fuel, we are dedicated with sharing each other's mistakes and learning from those mistakes. And I'm excited to hear what mistakes that you have made in your career. And I would love if you would tell me and our listeners what clinical mistake you have made, or one that you think about maybe early on in your dental career that you maybe still remember, and how you handled it.
I look at dentistry sometimes, the services that we provide, as kind of like a menu of lists of things that we can do. I call it a sushi menu in my courses of, now you can add sleep apnea and snoring treatment to your menu as people go down the list of things that they have problems with and whatnot. And unfortunately, we think, let's take a course like placing implants, and then we can go in and right away feel somewhat relatively bold and comfortable in doing it. And earlier in my career, when I learned how to do implant placement, I was a little too gung-ho about doing most cases. So a couple times I had temporary paresthesia, get close to the nerve. And one time I placed the implant that was into the sinus, and we got a lot of bleeding. So these kinds of mistakes, I feel like I should have done the easier ones for a while and taken more educational courses and more advanced courses before wanting to keep things in-house. After 22 years now, I know I'm comfortable with what I'm comfortable with. I don't try to push the envelope just to, not have to refer the patient, because most patients do want to stay in your office for the treatment that you're doing. But some of these cases, we have to be aware that we may not be fully well versed in treating some of the complicated cases. And that was one of my clinical mistakes, was pushing myself too hard to do all the cases I thought I could do, instead of referring them out when I felt like a little bit more uncomfortable. And if in retrospect, I would have referred more of the tougher cases and gotten more training and spent more time on the education to be able to handle these tougher cases.
I resonate with that. I think that for many of us, we go to a CE course and we're ready. We want to get in there, we're ready to get thrown in there. And, oftentimes it's through those challenging cases that we learn, as you have. And sometimes it's learning that you got to punt sometimes and you can't do it all. And so, it's the practice of dentistry, as they say. And so we learn a little at a time. For you, though, how did you overcome that challenge of, hey, you know what, I can't take on these challenging cases, but I still want to do it. I'm going to backtrack a little bit and start focusing more on maybe some simpler cases that I can manage.
It's a lot of times we beat ourselves up for some of the failed cases that we have, right? It's an emotional beatdown of ourselves, guilty feeling. There's a little bit of, let's call it, confidence that gets deterred, and you become a little bit more nervous, a little more angry, a little bit more sad and depressed about your profession when things don't go well. And no one's perfect. I realize that in everything that we do in life, confidence is really important. And the way you speak to your patients resonates. If you're not confident about a procedure that you're doing, they're not going to be confident. It's going to show through the way you communicate with the patient. And so I actually started, taking more courses and understanding what I need to improve on. More specifically, I even took sleep apnea courses from other people back in the early 2012, 2013 era time to be able to do and feel really comfortable about certain procedures that I know I actually relatively enjoyed doing. So I looked at some of the things that I don't enjoy doing, like root canals, and I said, okay, no matter what, I'm going to stop that. I'm not going to try to push myself. So you got to see what you're comfortable with, and that's what my vision was, is I'm comfortable in doing a certain procedure. Let me get better at it by taking some more courses, and then just keep practicing and doing more and more. And ultimately, it was confidence building in yourself, understanding your self-worth, and not beating yourself down was really the pivotal part for me. Because even that one crown that cracks, or the one patient that comes in after a routine silver filling removal and they're like, oh my God, it wasn't bothering me before, now it's killing me. We get that all the time, right? I just don't beat myself up for it anymore. If it's not me, it's another dentist that would have done the same, probably in the same demeanor. I hear it all the time from some patients about another dentist experience. We can't be perfect. 100 out of 100 patients walk in and walk out happy and never, complain. And so taking the burden off yourself of that perfectionist mindset really, really needs to be done, and learning how to breathe and push through, try to fix what you can. And if you can't fix it, you let them know and you refer out, you refund the money as accordingly, and you move forward.
Thanks for tuning in to this first episode with Dr. Radfar. We hope that you will join us next week for another conversation where we talk about financial mistakes. If you're looking to grow your practice and need some help along the way, be sure to check out 90-Day Jumpstart. You can start for free by contacting Dr. David Rice. Check out the link to his Calendly in the show notes.